Max Brito is Associate Professor of Medicine and the Vice Chair for Urban Global Health in the Department of Medicine. He is also the Chief of Infectious Diseases at the Jesse Brown Veterans Administration Hospital. His clinical interest is the care of patients infected with HIV. His scholarly work focuses on HIV prevention in Caribbean men. Dr. Brito serves as the coordinator of the Dominican Republic Project, an educational exchange program that promotes collaborations between students and physicians in the Dominican Republic and UIC.
My work in the Dominican Republic, the country of my birth, began shortly after I started working at UIC 11 years ago. The country, who shares the island of Hispaniola with Haiti, has been classified as middle income, but tremendous social inequalities exist and there is inadequate public health infrastructure. It has a population of 10 million people residing in 32 provinces. The capital city of Santo Domingo was the first European settlement in the Americas, and the beauty of its monuments and beaches stands in sharp contrast to the poverty of some of its communities. In 2004, I traveled with 2 medical students and 1 medical resident to establish an exchange program to support clinical rotations for UIC students to learn about tropical medicine and healthcare delivery in resource-constrained settings. This rotation has become quite popular in the Department of Medicine. To date, more than 100 UIC trainees have traveled and participated in educational projects in the Dominican Republic. The program is now an elective for internal medicine residents who are selected based on their academic performance. From the beginning, it was important for us to ensure that these exchanges were also a benefit to Dominican students and trainees. Thus, we created a clinical rotation at UIC for Dominican internal medicine residents and fellows specializing at the largest teaching hospital in the country. Dozens of Dominican students and trainees have visited UIC to participate of our educational programs over the years. This project is both academic and cultural. Our objective is that UIC trainees learn as much about Dominican and Latino culture as they learn medicine. On occasion, UIC students and trainees have stayed with Dominican host families, and Dominican students have been hosted by UIC trainees in Chicago. This project has a scholarly component. Since 2007, we have conducted implementation science projects in HIV prevention. In collaboration with Dr. Robert Bailey from the School of Public Health, we began exploring the acceptability and feasibility of introducing male circumcision for HIV prevention in high-risk men. In early formative research, we found that approximately 2/3 of men were willing to undergo a circumcision to decrease their risk of HIV and STIs if provided with information on the benefits of the procedure. After these studies were completed, and with funding from the UIC Center for Clinical and Translational Sciences, we designed and implemented a pilot project to introduce male circumcision in 2 clinics serving large numbers of high-risk men. In all, 539 men were circumcised in this project. The rates of adverse events were low and the level of satisfaction among them was high. Equally high was the satisfaction of their female partners. However, in the Dominican Republic, an epidemic that was once considered generalized has transitioned to a more concentrated epidemic affecting mostly men who have sex with men. Despite considerable progress in decreasing the national HIV prevalence to less than 1%, it remains unacceptably high in these men, who contribute, on the average, 1/3 of new infections. Prevalence of other sexually transmitted diseases is also high in this population, and high-risk behaviors and drug use are common. For these reasons, we became interested in working with men who have sex with men. Preliminary work done by our group and our students with men from the eastern region of the country found very high rates of herpes, syphilis, and HIV. More than half of men interviewed reported inconsistent condom use, and 78% reported having received money for sex in their lifetime. 1/3 reported consuming illicit drugs in the preceding year, and 22% admitted to regularly using sexual enhancers. This data highlight both the high burden of STI as well as the context of vulnerability in which men who have sex with men live in the Dominican Republic. We collaborated with a local NGO, Clínica de Familia, who was willing to pilot a new service devoted to the sexual and reproductive health of men. This new clinical service started in June of last year, and to date, more than 100 men have received services which include regular physical exams, harm reduction interventions, reproductive cancer screening, and STI care and treatment. UIC faculty and infectious disease fellows were responsible for training the clinic personnel on how to adequately provide care to men, including MSM. In a short period of operation, this service has become a model for the care of men in the Dominican Republic. It is important to mention that every one of these projects involves UIC students and young doctors. In some cases, students and residents have been the lead investigators on projects, spending considerable amount of time in the Dominican Republic. Students hail from both the College of Medicine and the School of Public Health. Some of these projects have been their capstones and field practica required for graduation. Public health and medical students have worked together on field projects which promotes interdisciplinary collegiality and facilitates future collaboration. Like every public health endeavor in a resource-constrained setting, securing funding for these activities remains our main challenge. We are constantly exploring the few opportunities for research and service funding that become available for that area of the world. The Urban Global Health Gala of the Department of Medicine is held annually to help fund some of these activities. Our goal is to establish a permanent UIC presence in the country, a locale with address and phone number, where our students and faculty can develop their projects, but more importantly, where we can collaborate with other colleges in the institution to solve the most pressing environmental, infrastructure, educational, and health-related problems afflicting poor Dominicans. I think that these health-related projects will serve as a springboard to even more ambitious goal for the College of Medicine and UIC Global's presence and commitment. Thank you.